When should stitches come out? That's a very common question that patients have. And where they're used, why they're used, how they're used, when to put them in, and when to take them out. So let's get started.
Behind the mask. The more you know, the better you look. Behind the mask.
Let's just start by asking, why do we use stitches? It seems like a simple question. If you are walking through the Amazon jungle and you get a branch that cuts your cheek, you're probably not going to be able to find a plastic surgeon anywhere near you to be able to close that. So, what would happen? Well, nothing would happen. Your body would heal that laceration just by itself. So why do we even need stitches? Well, stitches do a few different things. Number one, they're very good for reapproximating the skin so you get a much better scar. So if you're in the Amazon and you get a laceration, you're going to have a better scar if somebody's there to sew it up for you, to place the stitches. The second reason why you would get stitches, if you could, is it'll stop the bleeding. So you'll be walking through the Amazon looking for jaguars, and you're going to have a continual drip of blood, and it'll probably drip for a day or two, and then you brush it and it'll kind of reopen and it'll start bleeding. So we put it there, we put stitches in. The second reason is to stop the bleeding. And those are really the two main reasons why we place stitches. Because your body knows how to heal, it's going to heal. But when we do plastic surgery, we're trying to get the very best scar possible. So we very carefully place the sutures so that we get that finest scar that we possibly can. You're going to have a scar. Whenever we cut through the deep dermis, you're going to have a scar. That's the way your body heals. Your body doesn't heal by regenerating tissue to give you a new, fresh skin. It heals by scarring. Now, the enemy of scarring is tension. And so when we do suturing, we place stitches at different levels. So if you just have a laceration on your cheek, we're just going to use one layer of stitches because it's not very deep, and we're just going to reapproximate the skin. If you have an incision that goes into your abdomen, or in plastic surgery, we do a tummy tuck, or breast surgery, those incisions are much deeper. They go full thickness. They go all the way through the skin, and they go deeper. So when we bring things together, we put multiple levels of stitches in. So there's two main types of stitches, those that dissolve and those that don't dissolve. Any of the stitches that absorb, you can't use them on the skin because there's no water there. If they're exposed to the air, they're not going to dissolve. They'll have to dissolve from the inside. So typically, absorbable stitches are used underneath the skin. Non-absorbable stitches are used above the skin. And everybody wants the dissolvable ones because you don't have to go back to the doctor to have them removed. But for something like a young girl with a laceration on her cheek, you want to get the very best possible scar. You're going to use a permanent stitch in that situation because we're going to use the stitch to keep the wound reapproximated until your body heals. That's what determines when you can take the stitches out, is how strong is that incision. So if you have a 4-year-old, they're going to heal very rapidly, and you don't need to keep the stitches in longer. The longer you keep the stitches in, the more possibility you have of having marks from the stitches. So we don't want that. Can't take them out on the first day because the incision would be too weak and it would just open up. But we don't want to leave them in so long that they start to leave marks. So about 5 to 7 days is what we would do, is the time frame we would remove stitches in somebody's face. Maybe if somebody's a little bit older, in their 80s, and it's a skin cancer has been removed, you may leave the stitches for 7 to 10 days, rather than in a young 4-year-old, you'd leave them 5 to 7 days. Just because of their healing, obviously, is a little bit different in a 4-year-old compared to somebody in their 80s. So let's just look at the types of sutures now. Remember, I said that there's two types. There's a permanent type, and then there's a dissolvable. So right now we're going to be talking about this permanent, and there's multiple sutures. If you go into the hospital, into the suture room, There is literally an entire wall full of sutures. I'm only going to talk about a few kind of common popular ones. In general, and I'm not trying to make you a plastic surgeon, but in general, the lower the number, the bigger the stitch. This Proline here, it's a 0. That's a very thick, that's very strong. That's going to be not used on the face. That's going to be used in a totally different application. And then as you go through the numbers, the sutures get smaller. So that's a 2-0, 3-0, 5-0, and this one here is a 6-0. And this is personally what I would use if I was operating on a young girl's face. It's a nice, thin, delicate suture, but it's strong enough to be able to keep the skin together. So the smaller the suture, the better your scar is going to be. You would never use something like this on the face. That would leave a horrible scar. So we use something very fine and very delicate. So this is a 6-0 Proline. And pretend that this was a laceration here. And the stitch would come in. You can see it's a small needle. It's a very fine suture. Here you go. And then these little stitches would just be tied. And it just reapproximates the skin and stops the bleeding. And the reason why we're using this permanent stitch, even though the stitch is only going to be here temporarily, we want to have a stitch that's permanent rather than one that gets absorbed. Why wouldn't we use a dissolvable stitch, an absorbable stitch? It would make more sense. So you got a young girl, she's not going to want to come back, have her stitches removed. Well, the reason is because the absorbable sutures, they dissolve because of your body's reaction to them. So your body generates some water and hydrolysis, which will degrade or dissolve the suture. That creates more of an inflammatory response, and that can leave you with a worse scar. And then when we come back in the 5 days, 7 days to remove the stitch, there's less reaction, and we just cut that stitch out and just remove that. So you just pick up the stitch, and then the stitch just gets cut. You never want to, and I've seen this before sometimes with people removing stitches, and they're like this, and they cut both sides. And that's a no-no, because look, it leaves a little, that other loop stays in the body. So we don't want that. And you just cut one of them, and you just come in and just give it a little cut here, and then that removes the stitch. Let's look at one of the stitches that we commonly use for a tummy tuck, and this is an absorbable suture. It's very strong. This is incredibly strong, but this stitch will dissolve. This takes about 6 weeks for your body to dissolve this suture, because that's about how long it takes for a lot of the things in your body to heal. In terms of strength, the wound bursting strength is about 6 weeks. You'll have a very strong wound, and so we can use something that we don't want to necessarily be there forever, but we just need it to be there for a long enough period of time that your body has healed it enough that you don't need a stitch hanging around there anymore, so this just dissolves. But it's a very different material. This has got a texture to it, and this is much more reactionary because your body's going to dissolve this with the hydrolysis. There are other stitches. This one looks a little bit like that permanent stitch that I was showing you with the Proline, the blue one that I used to swap our imaginary 4-year-old. But the PDS will last longer. This is also very strong. It has a feeling and looks more like a permanent stitch, but it's actually an absorbable stitch. And so I use PDS when I do a breast lift, for example, and I'm reshaping the breast. We want the breast to be as perky and as high as possible. I want to use a stitch that's going to last a little bit longer than 6 weeks, but I don't want something that's there permanently. And by that time, everything is as strong as it possibly can be, and you'll get the most volume and perkiness and best shape to your breast. So I use this. This is on the inside. People sometimes wonder what happens to the actual track. That little tract that's there where the stitch went, your body can't heal that because that stitch is in the middle and it's preventing your body from closing and healing. But what we do is when we go to remove the stitch, we just cut one limb, remember, and then we take that stitch out. And so technically now that little tract where the stitch was is still, still a little opening there, but that'll close down within 24 hours. That will just close together and you won't even know that it was ever there. So if you have any questions about stitches, then please, by all means, leave a comment and I'm happy to answer your questions. I try to go through all the comments and give answers to all of them. And also, leave a little note where you're from. It's always interesting to me where people are from. So if you have time, you don't mind, just leave a little comment and say where you're from, where you're watching the video from. Thank you so much. I really appreciate you watching and look forward to talking to you next time.